Okay, so good afternoon everyone. Today we will discuss the practice applications of nursing informatics. Here's an overview of the topics we will discuss today. Okay, muna siya, no? First is a brief overview of practice application. Now, the inevitable integration of computers into the nursing practice has been accompanied by speculation and controversy. This is mainly because there are concerns, okay? Concerns or issues in regards to the use of technology in the healthcare practice. Diba? Natatutusto na itong unreliability, katong cost, no? We have already discussed this, diba, in our issues in informatics. Okay? Issues in informatics. But at the same time, no, there has been research that has been conducted on the benefits and barriers and the real potential of the nursing information system. Okay? Specifically among which I want to highlight the benefits. Mainly, class, its main benefit is to improve clinical practice. Okay? Hala. Its main benefit is to improve clinical practice. Tana mo na ako, sir, how does it improve clinical practice? Diba? Obviously, we've already talked about this. It increases efficiency. It increases efficiency and decreases workload. Diba? Decreases workload. No, that is one of the main benefits as to why we use technology. No? So, most practice applications affect these parts of the nursing practice. Atong nursing care plans, nursing outcomes management, discharge planning, documentation, and healthcare collaboration. Na mahutana ka na ako, sir. Sir, ngano wala man diha, sir? Ngano wala man diha, sir? Ang atong mga monitoring. Why is monitoring not there? Okay? Ngano wala man diha ang monitoring? Simply put, class, monitoring, even though it is available today, it is not a major part of our practice application yet. Okay? However, I will discuss monitoring in a later topic, specifically in the topic that involves what we call our it involves our consumer use, no? Consumer and patient use of computers for health, no? That is the next topic. Muna na siya itong first semifinal topic, no? So ako na siya i-appeal dito. It is much more relevant there. So nga rin siya basics na sa ta. Okay, so nursing care plans, how does it affect? How does informatics affect the creation of nursing care plans? Simply put, nga na siya, class. Computer-based patient records such as our electronic health record. Okay, electronic health record provide automation. When we say automation, automatic on the creation of nursing care plans. But more often than not, this is mostly used as a template. When we say template, gani class, it is a blank slate. Blank na siya, class. Okay, it is na mura na siya blank slate. Okay, ngani naman na siya, class. Okay, here is how the process works. Let's say, for example, the patient is male, 65 years old, and they have hypertension. Male, 65 years old, and hypertension. Okay? Kana siya, class, that data is from your electronic health record. Now, using that data, class, we will input that data into our system. And our system will create or generate a nursing care plan. But this nursing care plan is a generalized template. Meaning, kini sa nursing care plan, it is a template that caters mostly to males who are 65 years old and have hypertension. Okay? It is just generalized, no? So, here's the thing you have to remember, di ba? Ang atong nursing care plan, class, it must be individualized. Di ba? Individualized, because if you remember, class, each patient is unique. Laylay sila situation, laylay sila factors, no? Because of that, no, a generated nursing care plan, na outcome na to, no, a generated nursing care plan, okay, which is generalized, it needs to be customized, okay, customized or modified to make it individualized. Okay? Now, even though we still need to customize it or modify it, it decreases our workload in a big way. Because dili na tayo maghimo-himo, we are no longer gonna create a basis, no? We are no longer gonna create a basis or a generalized nursing care plan. The computer or the system will do it for us. Yan. Kini siya class, one of my favorites class, Nursing Outcomes Management. Nursing informaticists use predictive algorithms. Ayan, kakuya on the word class. When we say algorithm class, no, it is a series of instructions. It is a series of instructions that pumps out or gives us outcomes. It is a series of instructions that gives us outcomes. When we say predictive, we are gonna predict the outcomes. Okay? Predict the outcomes. We use this class to evaluate the relationship between nursing interventions and the eventual patient goal. Okay, the eventual patient goal. Yan na siya class. Here is how it works. Okay? Let's say, for example, class, sa imong electronic health record class, sa imong nursing care plan. The patient has 40.3 degrees Celsius. Ayan, taas kay siya, no? Diba? Sama na siya, fever. Grabe kataas yung fever. Normally, ang atong goal when it comes to fever is to decrease temperatures, diba? To decrease body temperatures. Now, let's say for example class na atay duha ka possible interventions. Okay, possible pa ato papilian how we still need to choose. First is our tepid sponge bath. Next is our antipyretics. Okay, antipyretics. Now class, we will input that data. We will input kini silang duha ka data into our predictive algorithm. Okay? Our algorithm will use two factors. Number one, it will use historical data. It will use historical data. What we mean by historical data is this. It will check all previous interventions, that all previous patients that used tepid sponge bath and antipyretics to check their effectiveness. Okay, kitao niya if effective ba ang mga past uses sa ato ang tepid sponge bath or antipyretics. Aside from that class, the algorithm will also use patient data. Okay, it will check the patient's electronic health record to see if the patient is to see if the patient is reactive, no, or capable of undergoing or treating kanang adapting themselves, no. It will also check, no. So yan na siya, predictive algorithm. Okay, and the algorithm class, it will give us what we call a prediction. Tagaan taniyag predicted outcome. Okay, predicted outcome for patient goals. For example class, libugya po mo class ha. Let's say for example class, we give it ato siya tagaan class, sige ato i-reason. Ito siya, tepid sponge bath and antipyretics. Okay, let's say for example, we input tepid sponge bath first. Okay, and the algorithm will predict that A, tepid sponge bath will decrease temps by 1.2 to 1.4 degrees Celsius in 2 hours. Okay. Muna siya yung prediction, ha? That is their prediction towards our patient goal. Diba? Itong goal is to decrease temp. Let's say for example, aside from that, we also input our antipyretics pack. We input our antipyretics. And it will also give us a prediction. Antipyretics will decrease temps by 2.1 to 2.4 degrees Celsius in 2 hours. Okay? Now, based on that prediction class, which one do you think is more effective? Diba? Which one do you think is more effective? Obviously, this one is more effective, diba? Because it decreases temps even more. But here's the thing, ha? Ang kini siyang prediction class, the prediction is not dili na siya maong atong definitive action. This is not a definitive action. What we mean by that is dapat dili na nato sundon. Ano? Dili dapat sundon. Dili na siya mao ang atong main reason why we're gonna do the intervention, no? It is merely a decision support system. Decision support system. Okay? So it will just help us decide if sakto ba atong buhaton, no? It instead of being the definitive action mo ginatong buhaton, no? It will just help us decide, no? Because in the end, ang kanang atong decision, no, it is truly based on the healthcare provider. Kita gid mi nagbuta na the nurses and the physicians, di ba? Next is discharge planning. Discharge plan systems provide continuity of care from the hospital to the home. Okay? The use of technology is evident because it provides the healthcare provider with means of communicating with the patient. Now, when the patient is discharged, class, more often than not, we can no longer communicate with them. Diba? We can no longer communicate with them. Number one reason is because dili natatagdo na nila. Diba? In their mind, they have already, they are already fixed. Na ayun na sila. They are already cured. Okay, so they don't need, dili necessary sa ilaha ang magig-interact pa sa nurse or sa healthcare provider. But here's the catch, okay? When it comes to discharge plan, we still need to evaluate it. Okay, we still need to evaluate the discharge plan. The reason for that, the reason for why we need to evaluate, no, is to check their compliance. Ato kitaon if gisunod ba gid nila ang discharge plan. Now, maglisod tag contact nila, class. That is why we will use software and hardware. Specifically, class, kana mga software and hardware used for communication. Like kanang emails or instant messaging, kanato mga cell phones, so on and so forth. Okay? It provides us with easier back and forth. Muna simplemente back and forth communication with the patient. That way, no, we can ask them questions with regards to their compliance. So ato na ma-evaluate if disunod bagid sila sa ilahang discharge plan. Okay? So here are the components of the discharge plan. Number one is a summary. Okay, dapat inyo nibutang ang summary of the assessment specifically from your initial comprehensive assessment. Okay, if you remember from your health assessment, the initial comprehensive assessment is the first assessment we do when the patient comes into the hospital. Muna yung pinakauna. As the term itself, no, initial, it is the first and it is comprehensive. It means kompleto tanan system dia, class, igo head to toe assessment gina siya with interview, di ba? Aside from that, we should also put a summary of their learning needs. When we say learning needs, mo na siya ang atong nursing health teaching, di ba? Dano na itong health teaching, ma'am, dapat every day 8 to 10 glasses of water. You have to take this medication before meals, kini siya ng medication after meals, no? We have to put a summary of learning needs in their discharge plan so that there is a method in which the patient can track if sakto bang ilang gibuhat. Okay? Next is we should also put the multidisciplinary plan. So multidisciplinary gani, class, it is not only the physicians, no? Dili ra ang physicians but also, for example, kanang mga PT, kanang mga OT, kanang mga nurses. Unsa may plano nato per se sa tanan disciplines, no? Nakan pa na, etc. pa na, no? Next is medications and procedures that the patient must continue at home. Okay, must continue at home. Most of the time, ang mga medications na i-continue at home, mao ni siya ang katong mga medications that are katong mga maintenance medications, no? Specifically, most likely kanang mga para sa heart, di ba? Kadaghanan gid para sa heart gid, no? Because it's very common, no? Aside from that, naapoy procedures class, no? If you do not know, sometimes ang patient, they will be discharged na naapay NGT. Okay, discharge sila na naapa sila NGT. Okay, so in instances like that, no, we have to teach SO how to suction. Aside from that, how to feed. Tudloan nato silang sa pag feeding, no? Nga na ba? And lastly is a summary of selected patient outcomes that the multidisciplinary team desired as the minimal criteria for an effective healthcare. Okay? Minimal criteria for effective goal attainment. Okay? Like for example na class is selected patient outcome is after 1 week, the patient will no longer have headaches. Kana mga attainable, di ba? We have to discuss na katong SMART, no? SMART, attainable, SMART, measurable, attainable, realistic, and time-bounded. Di ba? So, mo na siya, no? Patient outcomes, no? Atong planning. Now, mo lagi natin sa istorya, di ba? After 1 week, no, most of the time, we can no longer contact the patient to ask them if they are still experiencing headaches. That is the reason why kinahanglan ta og communication system between the nurse and the patient so that we can evaluate and check their compliance or check their status. And next is documentation. Nursing documentation has been made easier by way of our electronic health records, our EHR. One of the primary advantages of the EHR is customizability depending on the situation. Okay? Customizability depending on the situation. What we mean by that is that the EHR can be customized based on need. Okay? Kung unsay kinahanglan. For example, we can customize the EHR to cater to cardiopulmonary patients or to cater to orthopedic patients. Depende sa kinsay ma-admit na to. Di ba? It depends kung kinsay ma-admit na to. But the good thing is it is customizable. So as I've said, no, dapat ang ato mga health records, atong documentation, it must be individualized, it must be unique. Okay? It must be unique. Okay, next is healthcare collaboration. Now, collaboration with other members of the healthcare team has always been a critical component of nursing. Now, if you do not know, di ba? If you do not know, ang kita mo mga nurses, no, we are considered to be the generalist in the hospital, meaning wala tayo specialty, di ba? We are the all around. Kita mo all around, no? So in that way, no, in that instance, no, in that way, we are the ones who are always collaborating with other members of the healthcare team. Okay? Advances in technology, however, have changed the way in which members of the healthcare team are communicating by way of email, instant messaging, workflow simulators, and video conferencing. Now, class, as a kato na duty ko class, no, I have noticed this very well. No? Let's say, for example, class, na ay laboratory ni abot. Kanang laboratory, lab, CBC. Let's say, for example, class, na ay CBC. Okay? Na ICBC ni abot, and then ang doktor kay wala, out of town, no? So ang mga nurses dito class, no, they use email, ilagi email, they email the CBC, ilagi email ang CBC padung sa doktor, padung sa physician. In turn, ang physician class nagahatag og response. Okay, Ingon ng physician, okay, start this, start that. That way, no, mas pas-pas atong processing because there is no delay. Di ba? Even though the physician is physically out of town good siya, di ba? They were still able to do their job, no? So there was no delay when it comes to healthcare. Gamit ka na sa class. Ako nabantayan po, no, is gamit kayo ang messenger good sa hospital. Grabe ka gamit ang messenger sa hospital, no? Kanang bitong, for example, we are gonna call the patient, the nurse. Tawagon na to ang nurse na ang doctor or ang nurse sad, no? Doc, naadi mo patient dire, doc, gikuan doc ni atake sa may buhat ra ni, no? Pas kayo ang response if we use messenger instead of kanang manawag tas telepono. Sometimes dili ganin to bagon, di ba? No? So next is our critical care applications. Now, critical care nursing is an area of expertise within nursing that focuses specifically on human responses to life-threatening problems. Class, kini mga critical care applications, class mo ni siyang nasa ICU. Ayan. Supposedly, no, ako mag-discuss unta ko atong mga hemodynamic monitors, mga monitoring systems, so on and so forth. But as I've said, no, ang monitoring, I will include it in the next topic. Mas bagay to dito. Okay? Hemodynamic monitors, arrhythmia monitors, kanang atong mga ECG monitoring, di ba? No, sa ako lay appeal dito, no? A critical care nurse are those who are responsible to ensure that critically ill patients are seriously cared for individuals. Okay? Kanang mga ICU na mga nurses class, legit kana sila class. Okay, that's why their ratio is oftentimes 1:1, 1:2, pinakadaghan na 1:3. No, it's because ang ilang mga their patients are very, very ill. In that way, no, kinahanglan gyud sila focus. Okay? Critical care applications, areas where patients require complex assessment, high-intensity medication, and continuous therapy/interventions, and unrelenting nursing attention. So once again, mo ni siyang katong mga patients nga nasa ICU. Okay, so mo ni siya class ang atong critical care information system. Now, since it is a life-threatening problems, it is important that the critical care information system provides real-time data, specifically real-time resource utilization data. Ngani mo guna class? Okay? Sa ICU class, if you're gonna be an ICU nurse in the future, one thing that you will notice is grabe kayo mo kapaspas. You will be very fast when it comes to using resources. Paspas kayo mo class. Grabe. Kung good na good, dapat perfect yun na. So dapat magamit ganin mo gloves, gamit two gloves. Dili gid pwede, no compromises, no, when it comes to their care. So gamitan gid mo gamit gloves, gamit yun. So you're dili makakayong wasteful pod. We're not gonna call them wasteful. They are just utilizing a lot of resources, no? So dapat real time siya because it is a very severe, no, it is a very crucial or life-threatening situation. Okay? And the management of information in critical care areas. Okay? The critical care information system also enables electronic collection of hospital and patient-specific critical care data. Muna ni siya katong mga monitoring devices. And this generates real-time and historical progress reports. It needs to be real-time so that we can act quickly. Okay? But we should also track historical progress so that we can check for trends. Okay? Aside from that, we can also predict based on past precedent. Diba? Past precedent. Okay? Our critical care information system also allows automated collection and management of medical information, no? So here are the advantages of the critical care information system. Number 1 is it creates trend analysis, diba? Nagstorya ta ganiya kato atong historical data, no? With graphical representation of the results. It provides clinical decision support system. Very very useful class since everything in the ER is fast ICU, everything in the ICU is fast and crucial. We need support when it comes to decision making. Okay, provides access to vital patient information. As we've said, no, it has to be real time, diba? Real time, matik jud. And it provides feedback and quick evaluation of the patient's condition, and processes physiologic and diagnostic information and stores it. Mo na ni siya ato gitawag nga electronic health record. Okay, ang atong data storage. Ayan. One of the key aspects that you will see in the ICU is what we call our medical information bus. Ay mo kaihas ani class. Oh my god, agagig maihas ani. No? A medication information bus bali class mo ni siya ang atong bali sa hospital class sa tua pa mo ni siya ang atong USB, di ba? Ang USB, universal serial bus man na. The medical information bus is a connector. Okay? Connector that connects, let's say for example, a cardiac monitor to the EHR. Muna siya. It is a connector. Muna siya ang wire class. Okay? Ay mo kaya sana class. Kaya basi magtanaw mo ano, kuya ba nagnaw? No? It provides a generalized method of attaching patient monitoring systems to the computer system. Okay? That is one of the muna siya yung definition, no? Its main benefit is it eliminates the need for custom connector and software presently needed to interface such a device. Class, mga tanong muna ako, class. Sir, ngano dili naman lang sila mo gamit og USB? Sir, why don't they use USB? Now remember class, ha? Dumdumi ni class, ha? Most of the time, sa hospital gani, when it comes to, for example, kanang mga monitoring devices, most of the time, kadaghanan, kanang ilang mga monitoring devices that they are using are very old. Very old. Okay? Karaan na ng mga monitoring devices. Okay? And because it is very old, it also supports an older version of USB. Okay? USB 1 or USB 2. No? Now, if you know anything about electronics, you have to remember that USB 1 and 2, it is limited to 5 volts. Okay? 5 volts. Aside from that, class, the data that it can process is very limited. Class, because of these two factors, it cannot adequately relay what we call real-time information. Diba? Dili siya ma-real time. There is a delay. No? As you can see, class, tanaw ni mo, class, daghan kina siyag plug. Okay? Daghan kina siyag plug. Daghan kina siya og mga pins. The reason for that is so that there is enough bandwidth, no, to provide real-time information. Okay? Next is community health applications. Community health application is the collective term for the methodical application of information science to community and public health processes. Okay? Now, as you remember, or if you remember from your CHN, CHN emphasizes prevention of the disease, medical intervention, and public awareness. Pero ang number one gina na class is prevention, di ba? No? So the goal of community health informatics is effective and timely assessment that involves monitoring and tracking the health status of populations. Class, if you did not know, class, this was very apparent. Grabe gani siya kaklaro, class, during COVID. Okay, ito i-discuss later. Okay? We have what we call a community health application system. Okay, klaro kayo sa pag-COVID. It focuses on prevention, identification, investigation, and elimination of community health problems. Okay. What do we mean by that? Okay. One of the main tenets in our CHN is a community-based survey. Yan na lang. Okay? Because of that, no, we can identify if there are problems. We can investigate those problems. Okay? When we say prevention and elimination, class, when we say prevention and elimination, most of the time, the way we do prevention and elimination is through what we call um is through what we call public awareness. Okay? Through what we call public awareness, di ba? Na mga posters or mga post, no? Public awareness, no? Mga posters, mga post, mga messaging apps that will tell you, oy, na problema dire. What you do is like this, ana. Pag COVID, apparent ka na sa class, okay? Na ay COVID. Okay, what you do is you have to hand wash every day. Do not go out of your house. Wear a mask when you go out, di ba? Mag-face shield ka. That is a way of prevention. Okay? Apil po diha class sa atong public awareness ang elimination, di ba? Most often than not, ang atong prevention it stems, no, into our ability to truly eliminate the disease, no? Our community health application system gives us accessibility of data and information through communication technology. Okay, I want to highlight truly communication technology because this is the one that gives us our ability to have or to give the public awareness of a problem. Okay, this is the one that gives us our ability for the community to have public awareness. And lastly, it has what we call facilitation of data retrieval. Now class, in data retrieval class, you have to remember class sa atong community. In the community class, daghan kayo na og data. Okay? Specifically, gikan sa imong community survey. Now, we have to facilitate that data or we have to track and monitor that data. Mainly put because this allows us to check for trends. Trends in community. Okay? If for example, class, daghan kay nagkahilantan, daghan kay nagka-fever, we have, or that is a trend, di ba? Kini siya na barangay, daghan kay nagkahilantan. So that is a trend. Aside from that, we can check if there are ongoing community problems. Okay? Ongoing community problems. Okay? Aside from that, we can check, because there is a lot of data, the status of the community. Now class, you will learn more about this, no, in your CHN2. Pag CHN2 ninyo, mo na maguna siyang application of what you've learned in CHN1. Okay? So the advantages of community health assessment, number 1 is disease tracking, synchronization of decisions, national awareness and preparedness, strategy building, and control or spread of disease. Class, all of these were very apparent. Klaro kayo sila class pag COVID. Klaro kayo siya. It is very apparent. Specifically kining disease tracking class. When we say disease tracking, do you remember katong atong gitawag nga mag-contact tracing ta? Contact tracing by way of daghang kitog methods. Ang pinaka-common is kanang mga QR codes, okay, kanang mga logins. Dapat mo login ka if mosulod ka sa establishment. For example, another was GPS based para na sa iPhone, no? Ang kana sa iPhone legit GPS based contact tracing, no? Synchronization of decisions. Now, this is also very apparent during COVID, diba? Lahi-lahi og every city has their own way of managing COVID-19. As far as I know, among syudad no, ang Ormoc, no, it was very strict, like legit, lahi ra jud ang ka-stricto sa Ormoc. I-compare nimo sa other cities ato, lahi ra jud ang ka-stricto, no? But we still have to synchronize our decisions based on the what we call the national government, no? Dapat mosunod gyapon ta sa national government or sa ilang standard na ilang national government ilang maintain or ilang gibutang, no? So that's one of the reasons why advantage na siya, because there is increased communication. National alertness and preparedness. Naagya po ni siya pag COVID, katong by way of, this is the one that truly gives us our public awareness, di ba? Public awareness, di ba? Nato yung mga posters, na yung mga news outlets, tapos na yung mga posts sa Messenger o sa Facebook, mga nasa asa lang mga news, no, that warns us or prepares us, no, warns us and prepares us that na ay problem, di ba? Strategy building class, this is more commonly seen, no, sa katong mga higher management ko na unsaon nila pag-strategize around the problem. And lastly is the control of the spread of the disease, by way of all the other things it can help control the spread of disease, no, by way of all other factors maka-help siya control, no. So computer-based survey system, now this is used to collect quantitative information about data in the population to establish certain information. Okay, class, pamina mo class, when you undergo CHN2, hopefully maka-survey mo. Okay, hopefully maka-survey mo so that you can truly appreciate CHN, no. Hopefully maka-survey mo. Okay, so what we do is something like this. Okay, we input the community's data into a computer system. Ato i-input. Okay, ato i-input. Okay, and then we facilitate what we call our community survey. Back. Because of that, we will also input more data. Sige, tag-input class. After that, no, once it facilitates or once it analyzes that data, it will come up with results. Okay, expedited analysis and results. Okay, and with these results, class, mag-story na po tagbalik, class. It can help us detect trends in the community. Like for example, mo ana dito sa inyo, out of 100 patients, out of 100 households, 87 do not have clean water. Okay, so that is a trend, no? That is a trend. Baka kita taay sa daghanan sila, most of them do not have clean water, no? So it could precipitate what we call waterborne illnesses, diba? It could precipitate what we call our waterborne illnesses, no? Like for example kanang amoebiasis, diba? That is a trend. Posible na siya, no? Pisa tamingan, out of all 100 households, 59 households reported a member of their family suffered heat stroke. Oh, so pasabot na class, in the community, it is very hot. Walay mga kahoy, guro. Okay, walay mga kahoy or there's not enough drinking water. No? So that is a trend. Diba? Next is our, Next is our ambulatory care system. Now, ambulatory care class are services performed at outpatient clinics, urgent care centers, emergency rooms, ambulatory or same-day surgery centers, diagnostic and imaging centers. So, mao ni siya class ang mga patient nga naa sa outpatient department. When we say ambulatory class, it means they can leave after their procedure. Okay? In that vein, class, we also have what we call our ambulatory care information system. This provides automated processing of data and information such as allergies and medical alerts. Class, it is very crucial, class, to know or to automate the processing of data such as allergies and medical alerts, because most often than not, when they enter the OPD, wala tay information about nila. We do not have information about them. So when we have a system that is nationally recognized, okay, for example, in theory, we could have a system that is nationally recognized. Tanan hospital sa Pilipinas gagamit ana centralized patient information system. We could access a patient's healthcare data in the computer, no? And we can check if naa ba sila allergies or mga medical alerts. That way, the nurses who are caring for that patient will now know na, oy, allergy di siya ani, di ta pili mo na. Oy, na di siya medical alert. For example, dapat dili siya magpakuan, di siya magpainit. Or for example, this patient is not allowed to drive. Nga na, dapat as a nurse, no, we have to know about that, no? Aside from that, no, ambulatory care information systems is also involved in the patient's accounting system. Kanang mga charging, billing, discounts, and concessions of the patient, no? Mga na siya. The ambulatory care information system mainly focuses on speed and efficiency, especially with the amount of patients the healthcare provider will encounter on a shift-by-shift basis. Now, class, if tanaw ninyo, class, daghan og patient sa ER, class, mas daghan sa OPD. Okay? Sa OPD, class, dili naman na mga imaging, kana mga recheck, bisitag doktor, dili naman nga na. Okay? Sometimes sa OPD, naadiha ang mga kanang prenatal care. Naadiha ang ato ang mga, let's say, for example, what we call our mga dog bites, animal bites, para sa Eversley, no? So we have to focus on improved data collection to a customized system. Like for example, class, dapat naatay customized system that is solely for prenatal care para matik-matik na. Dapat naapuntay ka ng para sa mga basic emergencies, no? Like for example, dog bites, di ba? Basic emergencies, dapat ma-customize na nato ang the way we collect data through customization. We have to have template NCPs, di ba, na storya na ta, for commonly encountered problems. And lastly, because daghan kay patients, class, we have to improve on the processing of admissions. Kana bitong i-admit sila. Okay, we have to improve on that because that is one of the main reasons, one of the main what we call bottlenecks in the hospital. Dugay ma-admit, no? I think, no, I believe it is a virtue, or not a virtue, it is a problem of bed capacity. It is a problem of bed capacity, no? But in some instances, no, it is a problem truly of the system. Okay, hinay ra kay sistema when it comes to admitting a patient, no? So sa OPD, class, no, there is not a lot of monitoring going on around because as I've said, no, this is ambulatory care. Wala kay monitoring, class, kay they are just there for a simple procedure. Mga outpatient, mga simple procedure, wala kay na siya monitoring hitabo diha. So it focuses mainly on speed and efficiency. Kay daghan kay sila patients na madawat. Next and lastly is informatics solutions to emergency preparedness and response. Okay? Nursing informatics plays a crucial role in emergency preparedness and response by facilitating efficient communication, data management, and decision making among health professionals during emergencies. Okay? Now, class, during in emergency, class, no, most of the time daghan kay na siya og mga nurses, no, most of the time from different hospitals. So there needs to be coordination. Okay? There needs to be coordination. One of the main reasons, no, why we use informatics in emergencies is because informatics, as I've said, it provides us with a standardized form of communication. And by way of that, we can also coordinate easily due to this standardization. Masayo na lang ato communication. Even though lahi tag hospital gikanan, the way we talk, the way we communicate is standardized. No? No, her man eh. Okay, autocorrect. EHR during emergencies. Now, the EHR during emergency systems enable healthcare providers to access patient information quickly, even in high-stress situations. Okay? Even in high-stress situations. Nurses can use the electronic health records to retrieve vital patient data, such as medical history, allergies, medications, and treatment plans, aiding in rapid triage. Very important, class, no? When we say triage, we are categorizing the patient based on the severity of their problem, no? And we can categorize them easier if we have access to vital data like history, allergies, and treatment plans. No, it allows us to be much more efficient when it comes to that. The main problem there, no, is most of the time if masulti tag emergencies like this, it is two scenarios, my god. One of the scenarios is we could be in the ER. If nata sa emergency room class, it is very easy to access an electronic health record. Because most often than not, naa-G computer sa ER. Na-computer sa ER so we can easily access this system. But, let's say for example, class, ang atong kuan, ang atong emergency, it is not in the ER. Let's say for example, nasa gawas. Nasa ka na, let's say for example, landslide area. That ka na, maglisod tag-access sa EHR ana. Unless we have a remote or a portable portable device, no, that we can use. No? Next is our decision support system during emergency now. Our decision support system or DSS. DSS applications provide evidence-based guidelines, protocols, and decision-making tools to assist nurses in assessing and managing emergency situations effectively. Now, ani man na siya class, most often than not, kanang mga emergency situation man god, no, it is a very high tense, high stress situation for the nurse. In turn, maglisod og decide ang nurse. There is a tough time in decision making when it comes to the nurse. That's why no, most often than not when we say ER man god guys, may mo kag emergency room, daghan kina sa protocol. They have lots of protocols, they have lots of guidelines when it comes to handling the patients. No? But because of informatics, no, we have what we call our decision support system. This eases us, no? Masayo na lang, eases us. Eases us when deciding, okay? Because it gives us options on what actions to do that are evidence-based, okay? Evidence-based, no? These systems provide real-time alerts, reminders, and recommendations based on the latest clinical evidence, helping nurses make informed decisions under pressure. Okay, as I've said, no, kanang emergency, it is high pressure, high tension situation for the nurse. Magkurog-kurog jud ka na class. First time nimo makakita og patient nga gidunggab, magkurog-kurog ka because you do not know what to do first. Okay? Tanan ni imong training class mugawas sa imong utok. Mugawas, malimtan nimo tanan. The main reason for that is because as it is a high pressure situation. High pressure. Gawas na lang. So, you need support. Okay, you need support. That's why we have a decision support system. We also have simulation and training tools. Nursing informatics solutions offer simulation and training platforms to prepare nurses for various emergency scenarios. These tools simulate realistic patient cases, disaster situations, response protocols, allowing nurses to practice their skills, decision making, and communication and strategies in a safe, controlled environment before facing real emergencies. Class, one of the main things we can attribute this, no, or we can ato mahambutang, no, is katong atong bag-ong mannequin. I don't know if you know this, but the University of Visayas College of Nursing has a new mannequin. Semi-fidelity to siya class, semi-fidelity. So, dili siya high-end, pero dili siya low-end. Nindot kayo siya class, it's so cool. Okay? Mannequin siya class, but na siya pulso, na siya blood pressure, na siya breath sounds, lung sounds, na siya heart sounds, na siya tanan, na ka nang dilate yung pupils, constrict yung pupils, makataod tag catheter, and realistic pod, makataod taog IV. We can actually practice IV insertion in the mannequin, no? Assuming nga atong gigamit na needle is very small para dili ma-damage. Kana siya, no? It provides us with our simulation and training tools, no? Actually, class, I had the opportunity to test it, no? Last Monday. Ito Monday, nakatest ko, class. And one of the things I tested, was if we could do CPR, okay, cardiopulmonary resuscitation on the mannequin. And the good thing is we can, okay, we can simulate kanang CPR siya, no? And naka good thing ato no is katong mannequin class daghan kay sensor, no? So as I was doing CPR class, nakabantay ko class na ang iyang at first, no, when I did not do CPR, giset man to nila na ubos kayo ang iyang auto saturation. Zero po gid ang iyang pulse, zero ang iyang breathing rate. So when I did CPR class, no, it increased. Nisaka gyud ang iyang auto saturation, no? Aside from that, it gave me feedback on my technique. Gingnan ko class. Okay, the system after doing CPR for a few minutes class, the system or the mannequin was able to give me feedback, no, on the way I did CPR. Gingnan ko na most of my gingnan ko na 20% o 22% of my compressions. 22% of my compressions were not deep enough. Dili law mo kayo. It was not deep enough. Okay, so titagaan ko feedback ba? No. So in that instance, no, it gives us our ability to train our skills, practice our skills, and give us adequate feedback, no? So yeah, hopefully makagamit mo ato. As far as I know, ang una makagamit ato is ang mga third year. I believe tomorrow, Thursday or Friday, mag-return demonstration sila og colostomy care. So kato siya, no, naama sa to siya colostomy. Pili mo to tawag colostomy. Basta nila legit kayo. As far as I know, I believe makagamit mga to karon na SEM. I do not know if napa mo i-rate them ato. But as far as I know, makagamit ato una ang mga third year gid. And lastly is surveillance and monitoring. Surveillance and monitoring systems powered by nursing informatics enable early detection and monitoring of disease outbreaks, environmental hazards, and other public health threats. Class, one of the main monitoring systems I found, no, pinakanindot, it tracks environmental hazards is kata kanang sa Pag-asa. Okay? Ma-predict nila ang kanang typhoon, no? That's in the typhoon warning. Kaya bitong red rainfall. Red rainfall ana, no? That is surveillance and monitoring system. Another surveillance and monitoring system, makita ninyo sa UV actually, is kada bitong musaka ka pa dong sa kuan when you go up to the library sa dako na building, sa new building. There is an earthquake surveillance system there, no? Earthquake surveillance system, no? So surveillance na class, nurses can use these systems to track epidemiological trends, assess population health status, and implement targeted interventions to mitigate the impact of emergencies on communities. So we can use these monitors. Like for example, katong atong gitawag nga earthquake monitors, katong atong gitawag nga typhoon monitors, no? We can use this class to integrate targeted interventions. Like for example, dapat mo lakaw na ta, dapat we have to evacuate, no? Because there is a high tendency nga mag-typhoon dire, no? Pwede po tamo gamit og kanang mga monitors for disease outbreaks. Like for example, katong atong sa CHN, no, it is highly it is highly intertwined na atong community, highly intertwined with our emergency services, because mo man na siya usually ang maigo, di ba? Community man, no? So that is it. If you have any questions, do not hesitate to ask. And that is it. This is the final topic for your midterm exam. Okay? And as I've said, I will discuss monitoring devices in our next topic.